Has someone you love started showing subtle but concerning changes over the past year? Many people assume that death in old age happens suddenly, but the truth is that the body often sends silent signals months or even up to a year before life reaches its final stage. The problem is that most people overlook these signs because they initially seem insignificant. Only later, when looking back, do families realize that the clues were there all along. But by then it's too late to prepare, too late to cherish those final moments together. In this video, we will discuss 7 key signs that often appear about a year before an elderly person passes away. Some may be things you've already noticed, but attributed simply to aging. Others may seem like minor changes, but actually indicate a gradual decline in the body. Recognizing these signs early gives you the opportunity to provide better care, cherish meaningful moments, and most importantly, ensure that your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end, because these 7 signs can help you emotionally and practically prepare for what's to come. When you understand what is happening, it won't take you by surprise. You'll be able to make the most of the time you have left with those you love. Now let's begin. Number 1. Significant weight loss. When the body begins its final transition, one of the first visible changes is this involuntary weight loss. The surprising part is that it happens even when the person continues eating normally. You might notice that pants need a tighter belt, shirts seem too big, or the face appears thinner and more angular. The concern is not just the loss of weight itself, but what it represents physiologically. At this stage, the body no longer absorbs nutrients as efficiently as before and begins to break down its own muscle mass as an emergency resource. Arms and legs become thinner, and areas that once had some firmness now appear sunken or flabby. This process should not be confused with normal aging. We are not talking about the gradual changes everyone experiences over the years, but rather a clear sign that the digestive and metabolic systems are progressively failing. The body is losing its ability to extract and use the nutrients necessary to sustain itself. Medical professionals have a clear guideline. Losing more than 5% of body weight within 6 to 12 months without an apparent cause is a significant warning sign. To put this in perspective, for a person weighing 70 kilos, 154 pounds, this would mean losing around 3.5 kilos, 7.7 pounds, without dieting or having a diagnosed illness that explains it. Many families misinterpret this situation. It's common to hear phrases like, "It's normal to eat less at their age," or "We all lose weight as we get older." However, what is really happening is much more complex. The body is gradually losing its ability to process proteins and essential nutrients, a profound metabolic shift that goes beyond simply eating less. The loss of appetite that accompanies this process has multiple causes. On one hand, the senses of taste and smell deteriorate, making food less flavorful and appealing. Meals they once enjoyed may now seem bland or even unpleasant. At the same time, the sensation of hunger significantly decreases due to changes in the hormones that regulate appetite. This metabolic change triggers a devastating vicious cycle for health. Reduced nutritional intake leads to lower available energy, which naturally results in less physical activity. This decrease in movement causes further muscle weakness, making it more difficult to perform basic activities like cooking or even eating, worsening the situation. If you have noticed this sign in your loved one, it is essential to take action on 2 fronts. First, consult a doctor to rule out treatable causes and assess the overall situation. Second, adapt meals to this new reality, offering smaller but more frequent portions, choosing easily digestible and nutrient-rich foods, and presenting them in an appealing way can make a significant difference. Well-intentioned family members often make the mistake of insisting or pressuring the elderly person to eat more, creating tension and anxiety around meals. The most important thing is not to force them to eat larger amounts, but to understand that the body is sending a clear message about its ability to sustain itself in the long term. Number 2. Extreme fatigue. Does your loved one sleep more hours yet still seem exhausted? This fatigue is not like the tiredness we all experience after a busy day. It is a profound and revealing sign that many families misinterpret, but it carries a crucial message about the elderly person's overall condition. Extreme fatigue in the last year of life is very different from ordinary tiredness. This is not just someone who needs a good rest or vitamins. It is a persistent and deep exhaustion that does not improve even after a full night's sleep or several days of rest. It is as if their internal battery is operating at its minimum capacity, with no way to fully recharge. What many people don't understand is the real cause of this exhaustion. As the heart begins to pump less efficiently, every organ and muscle in the body receives less oxygen and fewer nutrients. Imagine trying to run your home with only half the normal electricity. Some systems simply won't have enough power to function properly. This is exactly how your loved one's body feels, even when they are just sitting down and seemingly doing nothing demanding. The effects on daily life are dramatic. Activities that were automatic for decades, getting dressed in the morning, making a cup of tea, or even having a 10-minute conversation, suddenly require extraordinary effort. I've seen elderly individuals who need to rest after brushing their teeth, something they would never have considered an energy-consuming task before. This change doesn't happen overnight. It starts with subtle signs, moments when the person needs to sit down unexpectedly during routine activities, or more frequent pauses during their usual tasks. Gradually, these episodes become more common until fatigue dominates most of their days, severely limiting what they can do without feeling completely drained. What happens at the cellular level is both fascinating and revealing. The body's metabolism undergoes a major shift. Instead of producing enough energy for all normal activities, the body redirects its limited resources to only the most essential functions. It is like a city experiencing a power outage where the little available electricity is sent only to hospitals and emergency services, leaving other areas in darkness. Many family members, not understanding this process, misinterpret the situation. If they just tried harder, they must be depressed, or they are losing the will to live, are common but incorrect assumptions. The reality is that this is not a matter of willpower or mindset, but an unavoidable physical process related to the decline of basic bodily functions. Sleep patterns also change drastically, creating a puzzling paradox. The elderly person may sleep more hours overall, but their rest is fragmented. You may notice more daytime naps, difficulty staying alert during social activities, and nighttime sleep that is no longer deep or restorative. This disrupted sleep cycle further contributes to their constant state of exhaustion. When you recognize this persistent fatigue in your loved one, it is crucial to adjust your expectations and approach. Many caregivers instinctively try to encourage the person to stay active or not give up, when what they truly need is something entirely different. The most valuable thing you can do is identify the times of day when they have the most energy, often in the mornings, and prioritize meaningful activities during those brief windows, while respecting their need for rest afterward. If you're still watching this video and finding these insights valuable, please comment number 1 below to let me know you're here. And if you haven't already, make sure to like this video, subscribe, and turn on the bell so you never miss any future videos. Number 3. Cognitive changes and withdrawal. Beyond physical exhaustion, there is an even more revealing sign that many families completely misunderstand. Your loved one may be physically present in the room, but mentally, they have begun to exist in an in-between space, somewhere between two worlds. What we mistake for simple distraction or dismiss as normal aging is, in reality, the beginning of a neurological process where the brain embarks on its own farewell journey. These cognitive changes go far beyond occasional forgetfulness. You might notice your elderly loved one staring out the window for long periods, or that during a family conversation, their gaze seems to pass right through you, as if they were contemplating something invisible to others. This being present without really being there is especially noticeable during gatherings they once enjoyed. They now seem like silent observers of a scene that no longer fully belongs to them. Temporal disorientation becomes increasingly common. Your loved one might wake up and ask if it's morning when it's actually evening, or they may mention events from decades ago as if they had just happened. This confusion is not random. It reflects a brain gradually losing its anchor to the present, allowing old memories, often the most emotionally significant ones, to take center stage in their consciousness. What many families find most bewildering is the fluctuation of these cognitive abilities. There will be moments when your loved one participates in conversations with perfect clarity, recalling surprising details and showing their usual personality. Hours later, they might repeatedly ask about people who passed away years ago or confuse close family members. This back and forth between lucidity and confusion is particularly hard to grasp, but it perfectly illustrates a brain functioning intermittently, like a light bulb flickering before it goes out. Social withdrawal manifests subtly at first. The person who always insisted on joining every family celebration now prefers to stay in a quiet corner, or even in their room while family life continues around them. This withdrawal does not reflect a lack of interest. It's that social interactions become overwhelming for a brain that can no longer process multiple conversations or stimuli at once. Sensory overload quickly exhausts them, making them prefer simplicity and calmness. From a neurological perspective, what is happening is fascinating. The brain begins to redistribute its limited resources, prioritizing essential functions and reducing the energy allocated to complex social interactions or processing new information. It's as if the brain is carefully selecting what truly matters in these final moments. This is why old family stories remain intact, while they forget what they had for breakfast an hour ago. Emotional changes are also significant and often misunderstood. Your loved one may display emotional reactions that seem disproportionate, sudden tears during a casual conversation, or irritation at situations they once handled with ease. Or conversely, they might exhibit an unusual calmness in response to news that would have previously upset them. This emotional detachment does not indicate indifference, but rather a gradual disconnection from everyday concerns. When you notice these changes, it's crucial to adjust your approach. Long explanations or complex questions become difficult for them to process. Instead, communicate with short, direct sentences, eliminating background noise and distractions. Maintain predictable routines that provide structure and security, and perhaps most importantly, avoid constantly correcting their mistakes or confusions. Little is gained by repeatedly reminding them of painful realities, such as the loss of loved ones they may still mention as if they were alive. Remember that this cognitive disconnection, far from being just a sign of deterioration, could represent a natural form of preparation. Many spiritual traditions and studies in palliative care suggest that this gradual withdrawal from the material world might be an adaptive process, a slow transition that allows the person to let go of the ties keeping them connected to this life. Number 4. Frequent infections and slow healing. Have you noticed how your loved one who used to recover quickly from a simple cold now seems to struggle for weeks with the same infection? A declining immune system sends clear signals, but many families misinterpret them as part of the normal aging process when they are actually specific warnings of a fundamental change. What happens at the cellular level is fascinating and revealing. The bone marrow, where white blood cells responsible for fighting infections are produced, significantly reduces its activity. As a result, every time a virus or bacteria invades the body, there are fewer soldiers available for battle. This decrease is not gradual, but accelerated during the last year, creating a vulnerability window that geriatricians immediately recognize. A small cut that used to heal in 3 or 4 days may now remain open for 2 weeks or more. This slow healing reflects not only the reduced immune capacity, but also the decrease in cellular renewal. The tissues no longer receive optimal blood flow, essential nutrients have difficulty reaching the damaged areas, and new cells are generated at a much slower rate. What is most concerning to medical professionals is not so much the frequency of infections, but the body's inability to fully recover between them. A pattern is established where each new infection begins while the body is still weakened by the previous one, creating a cascading effect that progressively deteriorates overall health. Another crucial aspect that many families overlook is how the presentation of infections changes in older adults in their final year. While in younger individuals, a urinary infection may present with pain and fever, in the elderly, It often manifests as a sudden state of confusion or marked fatigue. The absence of classic signs like fever, the body no longer has the energy to raise its temperature, leads to delayed diagnoses and less effective treatments. Pressure ulcers or bed sores represent a particularly serious risk at this stage. Once they appear, they become true strongholds of chronic infection, extraordinarily resistant to treatment. These points, where the skin has lost its integrity, quickly evolve from simple irritation to deep wounds that may reach the bone, vividly showing the body's inability to maintain its defense and repair mechanisms. Geriatric doctors have established a significant clinical criterion: 3 or more infections within a 6-month period, with incomplete recovery between them, is a warning sign of severe immune decline. This pattern consistently appears in medical histories when the last months of life are analyzed retrospectively. A particularly painful aspect for families is observing how antibiotics and treatments that once worked effectively now barely manage to control infections. What used to require a short cycle of medication may now need higher doses, combinations of antibiotics, or prolonged treatments with much less satisfactory results. When we recognize this pattern of immune vulnerability, our strategy must change. The focus can no longer be solely on curing each infection, but on preventing complications and maintaining comfort. Meticulous hygiene becomes essential, as well as avoiding unnecessary exposure to environments with a high risk of contagion. Visits from family members with colds or mild infections, which before seemed harmless, now pose a significant risk. Before moving on to the 5th sign, make sure to like this video, subscribe, and hit the bell so you never miss any future content. Let's continue learning together. Number 5. Changes in breathing and circulation. This circulatory redistribution is one of the most reliable signs that vital systems are beginning to fail. At first, the changes are so subtle they may go unnoticed. Perhaps you notice that your loved one is breathing slightly more shallowly, or that they take small pauses between breaths that they didn't before. Even minimal activities, like walking from the sofa to the bathroom, may leave them short of breath, something many families mistakenly attribute to normal age-related fatigue. As the weeks go by, these respiratory patterns become more evident. One of the most significant is known as Cheney-Stokes breathing, cycles where the breath gradually deepens, then becomes more shallow, until complete pauses occur that can last up to 30 seconds. These pauses may be alarming to family members, but they are part of a recognizable pattern for healthcare professionals. Why does this happen? The heart, that muscle that has faithfully beat throughout life, begins to lose its ability to pump blood as efficiently. This progressive heart failure means that each heartbeat moves less blood, reducing the oxygen available for the lungs, brain, and other vital organs. The respiratory system tries to compensate for this deficiency by altering its rhythm and depth. Peripheral circulation, the blood flow to the extremities, is usually the first to be sacrificed in this process. The body, in its innate wisdom, prioritizes vital organs such as the brain and heart. This is why your loved one's hands, feet, nose, and ears may feel constantly cold to the touch, even in warm environments or under blankets. It's not just that they feel colder, they are literally receiving less blood. In more advanced cases, you may notice a bluish coloration, cyanosis, in the fingers, lips, or even around the mouth. Another sign is the appearance of a mottled pattern on the skin, especially visible on the arms and legs. Purple or reddish spots that appear and disappear, like small islands in a pale sea. These are visible manifestations of circulation that can no longer maintain a steady flow to all areas of the body. Fluid accumulation in the lungs is another common consequence of this circulatory deterioration. When the heart no longer pumps efficiently, fluid can accumulate in the lung tissues, causing symptoms such as persistent cough without apparent cause, gurgling sounds when breathing, known as rales, or the need to sleep with the head elevated to facilitate breathing. Many older adults at this stage cannot lie completely flat without feeling as if they are suffocating. These changes deeply affect daily life. Your loved one may need to take frequent pauses while speaking, as if words consume too much oxygen. You may notice that they become short of breath even during sedentary activities like watching TV or reading. Their body is literally struggling for every molecule of oxygen it can obtain. If you observe these changes, you can create an environment that facilitates breathing. Keep the room cool but not cold, use humidifiers if the air is dry, and ensure they can rest with their head and torso elevated. These simple adaptations can make a big difference in their daily comfort. It's important to understand that these signs are not a medical emergency that must be fixed with aggressive interventions, but indicators of a natural process of gradual decline. The cardiovascular and respiratory systems are sending clear messages about their increasing limitations, and our most compassionate response is not to fight against this inevitable process, but to adapt to it with dignity and respect. Number 6. Mood changes and premonitory expressions. In the last months of life, a special language emerges that few people know how to interpret correctly. When an older loved one begins talking about packing their bags or embarking on a long journey, many attribute it to confusion. However, these travel metaphors appear with surprising frequency across cultures and contexts as premonitory expressions of the end of life. What's fascinating is that these comments are not hallucinations or delirium. A study conducted by Dr. Martha Twaddle, a palliative care specialist, documented that about 6 out of 10 terminally ill people show some form of advanced awareness of their imminent death, often expressed through this symbolic language. These messages tend to intensify in the last weeks or days. My mother started talking to her deceased sister as if she were sitting beside her, Eleanor, a patient, shared, reflecting a common phenomenon. At first I thought she was confused, but the clarity with which she described these conversations made me doubt. They spoke about meeting soon, as if it were completely natural. Another notable phenomenon is the sudden shift in emotional priorities. People who had maintained conflicts for decades suddenly seek reconciliation. An older woman may insist on handing over her wedding ring to a specific granddaughter, or a man may urgently express the need to settle unresolved matters. These gestures of material detachment reflect an internal transition. Mood changes can be unsettling for families. Periods of almost supernatural serenity alternate with moments of intense anxiety. A normally quiet person might become surprisingly communicative, sharing stories never before revealed. Conversely, someone sociable may become silent and contemplative. These are not mere whims. It's as if they're taking an emotional inventory of their life. Neuroscience offers partial explanations, linking these changes to alterations in neurotransmitters and brain oxygenation. However, the phenomenon transcends the purely physiological. Dr. Carlos Mendez, a geriatric specialist, notes, "We see similar patterns in people with full mental clarity as well as those with advanced cognitive decline. This suggests a deeper process than mere neurological dysfunction. One of the most enigmatic phenomena is the vision of deceased individuals. In a palliative care hospital setting, approximately 50% of patients report seeing or conversing with loved ones who are no longer physically present. What is remarkable is that these experiences are often deeply comforting, not frightening. Many describe these visions as real, clearly distinguishing them from dreams. Inappropriate family responses may include phrases like, "Don't say that, you'll be fine," or "It's just the medication." This denial, though well-intentioned, can create emotional isolation precisely when they most need to feel understood. Gerontological psychologist Antonio Vargas advises, when an elderly person mentions being ready to leave or seeing the end of the road, the best approach is to gently ask, "Can you tell me more about that?" rather than dismissing their words. These conversations also reveal changes in the perception of time. Many older adults describe a sense that time is shortening or that the days pass differently. This subjective phenomenon seems to intensify in the final months, creating a sense of urgency to resolve unfinished matters and express important feelings. Number 7. Changes in sleep and appetite habits. Adapting with dignity also means recognizing when the fundamental rhythms of life begin to change. While the heart and lungs show visible signs of transformation, more subtle but equally significant changes are occurring in the most basic needs. That relative who always enjoyed their favorite meals but now barely takes a bite is experiencing a profound reorganization of their internal systems. In the last months of life, the internal biological clock undergoes significant alterations. If you've noticed that your loved one is awake at 3 in the morning, staring out the window, or deeply sleeping at 11 in the morning when they were once an early riser, you're not just observing simple habit changes. What's happening is a true neurological reprogramming. This fragmentation of sleep arises because the hypothalamus, that small brain region that has regulated our sleep cycles for decades, begins to function irregularly. Day and night lose their biological meaning. An older person may accumulate the same amount of sleep hours, but distributed in multiple short episodes throughout the 24 hours. They are like islands of rest in a sea of semi-consciousness. This phenomenon doesn't respond to traditional solutions. Strict sleep routines or insomnia medications are ineffective because we're not dealing with a conventional sleep disorder, but rather a brain that is modifying its most primitive activity patterns. At the same time, the relationship with food undergoes an equally profound transformation. That apple pie that was your grandmother's favorite treat now remains untouched on her plate. The steak your father always requested for his birthday now seems completely indifferent to him. This new relationship with food reflects fundamental changes in the brain and digestive system. Geriatric doctors observe a consistent pattern. In the last months of life, a marked preference for sweet flavors arises, while salty or complex flavors are often rejected. Many people develop a preference for liquid or semi-liquid foods, such as yogurts, soups, or purees, not only for their ease of swallowing, but because taste receptors experience specific alterations. This phenomenon has a fascinating biological explanation. Bitter and salty taste receptors tend to deteriorate more quickly than those for sweetness, creating a sensory imbalance. What we interpret as a whim is actually the body seeking to maximize the pleasurable experience with the sensory resources that still function. Moreover, the hunger-satiety cycle, that biological rhythm that has accompanied us throughout life, begins to dissolve. Ghrelin, the hormone responsible for the sensation of hunger, is produced in smaller and smaller amounts. It's not that your loved one doesn't want to eat. They literally don't feel hunger with the same intensity or frequency as before. This reduction in appetite is part of a larger metabolic strategy. The body is actively decreasing its energy demand, preparing to function with minimal resources. It's as if the organism is gradually simplifying its needs. Daily routines that for decades revolved around 3 main meals and nighttime rest are now becoming blurred. Your loved one may feel hunger at midnight or want to sleep after breakfast. These alterations show us that the body is abandoning the temporal structures it maintained throughout adult life. For families, these changes are often the hardest to accept. We resist seeing our loved one skip meals or sleep at odd hours because we interpret these alterations as signs of deterioration that we must combat. However, the most compassionate response is not to fight against these transformations, but to adapt to them. Offer small portions of food that they still enjoy, without pressuring them to finish the plate. Ensure there are always easy-to-eat options available, especially those they prefer. Respect their new sleep cycles, allowing rest when needed, even if it's at hours that seem inappropriate. Number 8. A shift towards silence and inner reflection. As the final stage of life approaches, many elderly individuals exhibit a profound shift towards silence and inner reflection. Conversations that were once lively may become brief, and a person who was once expressive might begin speaking less, preferring to listen or simply observe. This change is not necessarily due to cognitive decline or physical weakness, but often reflects an internal reorientation, a withdrawal from the external world as they prepare for what comes next. It is as if their focus has turned inward, engaging in a deep process of review, acceptance, or even spiritual contemplation. You may notice them gazing into the distance for long periods, responding with only nods or short phrases, or showing less interest in discussing everyday matters. Some may stop engaging in small talk altogether, preferring quiet companionship over conversation. Others might become selective with their words, speaking only when they feel something truly matters. Medical and psychological studies suggest that this behavior aligns with the body's gradual conservation of energy. However, many spiritual and palliative care experts believe this shift goes beyond the physical, representing a natural transition into a different state of awareness. For family members, this change can be difficult to accept. The instinct may be to fill the silence with words, encourage interaction, or assume something is wrong. However, the most compassionate response is to respect their need for quiet and be present without pressure. Simply sitting with them, holding their hand, or offering gentle reassurance can provide immense comfort. Understanding that silence is not necessarily a sign of distress, but rather part of a natural process, allows families to support their loved ones with love, patience, and acceptance in these final moments. During this journey, we have explored the physical and cognitive signs that warn us about the limited time of a loved one. But beyond recognizing these signs, an even more important question arises. How can we use this knowledge to provide the best possible support? Identifying these changes should not fill us with fear, but instead give us the opportunity to be more present and aware. It allows us to transform uncertainty and anxiety into moments of love, connection, and meaning. As palliative care experts emphasize, the key is not to prolong life at all costs, but to ensure that each day is filled with dignity, peace, and sincere companionship. True wisdom lies not in resisting the inevitable, but in accepting it with serenity, recognizing that death is part of the natural cycle of existence. Instead of focusing on what is lost, we can focus on what can still be shared. In the end, the most valuable gift is not more treatment or more time, but our loving presence, our genuine listening, and our respect for their unique process of farewell. Accompanying with compassion gives us the peace of mind knowing that, when the time comes, we will have provided the most important thing: unconditional love and a farewell filled with peace. If you've made it this far, write "long and happy life" in the comments so I'll know who the true champions are. Don't forget to like, subscribe, and turn on notifications for more content. Also, share this video with your loved ones so they can improve their days as well. Now, check out this next video to keep learning. See you there.